Hello and welcome to InnoHEALTH Magazine Podcast. I'm your host Dr. Soumya Singh. In today's episode, we will be exploring about innovative technologies in healthcare delivery. To help us understand that, we have Dr. Vishal Arora with us. So Dr. Vishal Arora is Chief of Business Transformation at Artemis Medicare Services. With 14 plus years in healthcare, he specializes in hospital operation cost optimization and has worked with PwC, Medanta and QRG Medicare. He holds a bachelor degree in dental surgery and a postgraduate in hospital and health management. So, hello sir. So, I would like to start with a question that's cost optimization. So, as you know, the cost in India is rising in healthcare services. So, hospitals are under pressure to deliver high quality care to the while managing the expenses. So how can a hospital deliver better patient care while keeping costs under control in price sensitive market like India?
So when we talk about price sensitivity, yes, India is very price sensitive. So people expect that like they go shopping, right? They want discounts in the healthcare also.
Yes.
I've already spoken that we are 1/10 of what the global prices would be, but still. So what we have to develop, India has to evolve new and new methodologies to keep the cost under control.
Yes.
And that's something that can only come in what we have learned by reducing the length of stay. So now the focus is more on short stay surgeries. Focus is more on minimal invasive surgeries so that the patient is able to get the right treatment in the shortest span of time and the throughput is increased. So that's the focus area. Then in the area of AI, we are also taking help from maybe a CDDS, Clinical Decision Support System, CDSS, right? So where my technology would help my clinician predict if any untoward incidents would happen or ensure that the level of treatment they are providing is in the light manner, or they want to take a second opinion. So that's where we help them out so that they can also help reduce the stay. So that's the area. Or maybe a cross complication, right? So if a AI tool can predict a sepsis,
yes,
which eventually reduces the length of stay, which eventually reduces the burden of the patient. So that's an area we can look up to. But pricing and quality, they never go hand in hand.
Yes.
But given the dynamics, we are trying to maintain the cost and deliver what best can be done.
So since you mentioned about the technology, there are n number of technology out there in the market. So could you tell me a few technology that has really made the difference in patient outcomes?
So yes, first of all is the EMRs.
Okay.
So now we are on an electronic management record system where my doctors prescribe anything that goes directly into the system. So there are no transcription errors, right? So since it is prescribed in the system, it directly lines up my pharmacy as well, my lab as well. So there is no reading errors, no interpreting errors. They know exactly what is written by the doctor.
Yes.
It saves time. The queues have gone down, right? So that's one area. Second, technology is also being leveraged. Maybe today you can talk about feedback system in my hospital. We are completely automated. So there are QRs across the hospital. So wherein my patient wants to give me any feedback, he can just scan the QR, select the complaint, and we give a assured resolution in 30 minutes.
Okay.
Another example of technology, yesterday you must have read in the newspaper, so we have launched 5G network ambulance.
Okay.
Now in Delhi NCR, given the rising traffic, right, so that ambulance was just a medium of transport. Now we have turned them into mobile ICUs.
Okay.
So once you are picked up at your place of accident or the place of where you had called the ambulance, the moment you are picked up, you are put on the instruments that are put up, your BPA or the vitals are directly relayed to my ear. My doctors can see what is happening, what are your vitals, if any opinion is required. So eventually that transit time becomes the treatment time.
Okay.
So
the golden hour that is saved.
So the golden hour, we are redefining the golden hour, by this you can say. So golden hour will not start once you've landed up at the hospital. Golden hour will start once you are picked up at your place.
Okay.
So technology can play, and the examples are endless. So we are doing a post-COVID, right? So we are doing multiple teleconsults. Yesterday, we did a teleconsult of a patient sitting out in London, right?
Okay.
So that's the technology we have come up to, and technology is definitely helping patients the access to the healthcare, which in the current domain was limited.
Okay.
Yeah.
So since you mentioned about AI, so how does AI is helping in this domain?
I'll say end to end.
Okay.
So you start from any step, right?
Okay.
Maybe I'll give you examples of certain backend functions. RPA, robotic process automation for maybe submitting bills on a government portal.
Okay.
So we are a ESI CGHS listed empaneled hospital. So the bills have to be submitted. So what used to happen previously was the bills were photocopied. Then the entire investigation summary was copied. The length of stay, the entire description was copied. Then it was scanned, a file was made, and then it was manually uploaded against the respective folders.
Okay.
Now we are leveraging technology where from my HIS, the tool automatically picks up what needs to be pulled out, goes and attaches in the platform of the government panel the exact document, and that is submitted, right? So it requires a minimal human intervention, but it is well taken care of. One example. Demand forecasting, right?
Okay.
So supply chain function. When we talk about supply chain function, demand forecasting, right? Inventory days used to be crazy, like 15, 18, 20 days previously. Now sitting out in NCR, access to the supplier is very easy. We have brought down our inventory days to around 8-9 days.
Okay.
Right? So that reduces the burden on the organization. I require lesser space. My multiple POs are automated. So for a face mask, supposedly I have to order 10,000 every month. I define a reorder level of say 1,000 in my system.
Okay.
The moment it will hit 1,000, auto PO will be rolled out. They'll not ask us also because I have my RFQ done. My rates are standardized. My vendor is standardized. The requirement is there. The system will automatically sense that this is required. Go ahead and procure it. One more example, maybe now coming on to the manpower thing. One thing which we always talk about in healthcare, since you touched upon the costing topic as well, is the cost.
Okay.
And manpower and consumption are the two biggest costs for healthcare, right? Now what happens typically, suppose example of my one floor, I have 30 beds on one floor. Typically going by the standard rules, I will have 1:5 nursing. So on 30 beds, 30 patients, I'll keep 6 nursing by the ratio of 1:5. What we do now, leveraging to what we can do now, and we are envisaging this as well, is a dynamic rostering kind of a system.
Okay.
Where my system will be able to predict that tomorrow on these 30 beds, 20 will be occupied. So tomorrow you only need 4 nursing. You will have 2 spare which can be rostered where the gap is there.
Okay.
Or maybe they can be compensated by a day off, right? So ideally, typically what happens, I cannot predict my demand. I will keep all 6 nurses there and 2 would go waste. What the nursing will do, they'll divide 20 patients within 6 and see 3 or 4 patients.
Okay.
So I am not able to leverage the throughput or efficiency of my resourcing. So that's where the technology come into play. These are few examples. The list is, trust me, the list is endless.
Okay.
And your costing question also goes back and links to the same thing. That leveraging technology, opening the digital front door, we can really do wonders. We can really do wonders and save cost and provide a cost-effective treatment in India.
And eventually, like when there's more availability of technology, the cost will also reduce depending.
Of course, yes. So recurring cost would go down.
Yes.
And it would largely become a one-time cost. I'll give you one of the examples again. I love giving examples.
Yes.
I was to a hospital. Maybe hotel industry, we would have seen this. I was in Singapore last month, right?
Okay.
The room exit process is completely automated, right? You go to a standing kiosk, drop in your key, just enter your room number and everything, do the payment. If it is a prepaid room, just clear the bill and you move out of the room, right? So hospitals have also done this. Now the billing process, the OP billing process have gone automated. In fact, we are also exploring kiosks, which would be self-help kiosks, and where typically a manpower who is sitting 8 to 8 and charging me say 30,000 or costing me 30,000, these are very easy to do things, would be replaced by a standing kiosk, which would be hardly a one-time cost or maybe 1,000-1,500 cost here and there, which will be available for me 24/7, 365.
Okay.
Right? And given the era, given the technology adoption growing, at least in Delhi NCR, across the country as well, so we can easily leverage that and bring down our costs. So technology would definitely help in bringing down the costs.
So what about like technology in patient wait times? Like, so patient is very frustrating, so what kind of technology is there for this kind of in hospitals to reduce this queues and help to reduce the patient delays in patient care?
So this question I think popped in a little late. I had just answered that. I will also elaborate on it.
Yes.
So when we talk about technology in reducing patient wait times, right? So the kiosks, as I was saying, if I have a fully loaded manpower system, I can put in 6, 7, 8, right? But in the cost of one manpower, I can put in 10 self-help kiosks, right? Which would definitely help reduce the wait time. People can do self-billing.
Yes.
Those who you go to airports today, right? Your boarding passes are mostly automated, right? So that's how a self-help kiosk can come in, can help reduce patient wait times. Second example is the EMRs. So what we have done now with the launch of my new HIS, we are launching our new HIS.
Okay.
The moment you step out of my doctor's OPD, you will get a WhatsApp.
Okay.
The WhatsApp would have two links. One would be to download your prescription. Second link would be to generate pharmacy, to take pharmacy. The option would be like just take the pharmacy bill for it and we will get it home delivered. Or you can go to just pick up a counter of my pharmacy. You're not required to stand in the queue, pay it again, get it dispensed. Don't wait for it. You want to have a cup of tea by then, just go have a cup of tea. By the time you reach my dispatch counter, the pharmacy is packed up and you are good to go. Same thing we are doing it for labs and radiology. You just click on the link, you pay for your lab investigations, you are queued up directly at the sample collection, bypass every step.
Okay.
So that's a few examples what we are talking about to reduce the patient wait times. Across similar, we are running a Six Sigma project across my IP patients as well. So we now have a target of 70% rooms are vacated before 12 noon. So we have moved to night billings. All planned discharges, the planned discharge is billed at night. Before the doctor in the morning has to just come on the round and see the patient and say, yeah, you're good to go. By that time the doctor comes in, all the back-end formalities are run, the bill is ready, the bill is sent to the TPA, the processing is done, the billing clearance is done, patient will just wait for the patient doctor's round. What we have also seen, right, when we did this, there is a dependency of TPAs also on their manpower.
Okay.
So if a bill is sent by before 8 a.m. or 8:39, the approvals would come in less than 15-20 minutes, because when they go up, they are the first ones to receive that, and the approvals are that quick.
Okay.
And by 11, if you start setting approvals, the time would be anything between 1 to 1.5 hours, because your case has gone queued up, right? So it has a dominoes effect. So what we've seen, right measures taken at the right time in the right manner definitely help reduce patient wait time and gives a phenomenal PSAT.
Okay.
The patient satisfaction score goes out of the roof, skyrocketing.
Okay. So as we look ahead, the healthcare industry is poised for major changes. So according to you, what will be in future? What are the 2-3 biggest innovation or trends that you will think will change the hospital management in the next 5 years or 10 years?
So tech.
Yes.
AI, RPA. Yes. So leveraging AI and RPA, we've already moved to the era where clinical decision support system is coming. Predictive analytics have already come into picture, right? So I don't see any domain across the hospital where this cannot be leveraged. So this will reduce the load on the manpower. This will increase precision, reduce hospital stays, reduce cost across the hospital, and increase PSAT. So the more the hospital open their door to the technology, adoption of technology, we are laggards, and I will not shy away that Indian healthcare industry, in terms of tech adoption, we are still laggards. We are still doing dependent highly on manual interventions across. So the faster we move, the sooner we make ourselves more profitable and more precise treatment for my patients, and increasing the patient overall experience and journey across the hospital.
Okay. So thank you for sharing your insights, Dr. Vishal. Then thank you to our listeners for tuning in. So keep listening to us and tune into InnoHEALTH Magazine Podcast channel. And don't like to share, subscribe, and like our videos. Thank you so much.